And in this series, what we're looking to do is really broaden the conversation around transportation in our region. And I'm extremely excited about this particular session because, I think transportation and community health are those areas that, most people don't quite appreciate just what impact transportation has on our daily lives and our physical and mental health. So I'm really happy to have a great panel today to discuss that intersection of community health and transportation. And today we have Angelique Sharp from the Villard Avenue Business Improvement District, also a member of Coalition for Safe Driving Milwaukee. We have, I'm gonna go down counterclockwise here as I see on my screen. We have Kathy Gale from ERA's Senior Care Network in Waukesha. We have Darren Roush with the City of Greenfield Health Department. And finally, we have Obi Nwabuzor from American Heart Association. And special thanks to Karen Jackals for joining us today to help us with admin. So thank you everyone for being here. I'd like to open it up with, just a very quick little presentation here, just so everybody, knows about the Regional Transit Leadership Council and what we're all about. It really comes down to our mission, which is to unite regional leaders around shared strategies and actions to address our transportation challenges throughout southeastern Wisconsin. And what we envision is a better connected southeastern Wisconsin, regional, rapid, and modern multimodal transportation. A lot of people aren't aware, I suppose many people in the call are aware that more than 50% of the jobs in southeastern Wisconsin are outside of the scope of transit. That's a major focus area for our organization, but we understand that transportation, of course, being economic development and workforce connectivity, plays into a lot of our quality of life in our region as well. So our priorities from a policy standpoint are rapid and regional transit, specifically bus transit, as building on what we've already invested in with Milwaukee County Transit System. Last mile solutions that connect more people to further flung locations, more transportation options in general, whether it's biking or bike share or car share, scooters, and better conditions for walking and biking throughout our region. I want to give a special thanks to our funding partners. Without their support, none of this would be possible. So you can see here on the screen, Greater Milwaukee Foundation, Bader Philanthropies, Mandel Group, HNTB, Grafe, Milwaukee 7, CARW, the City of Wauwatosa, and the Milwaukee Regional Medical Center. And in the next few weeks, you should be hearing more about our initiative to find new solutions to the last mile problem. That's the challenge where, the bus stop, doesn't serve a further out or more low density location. Continued to vex our region and present tremendous challenges for, transit access. So thank you to United Way of Greater Milwaukee and Waukesha County, Wisconsin Economic Development Corporation, Grafe, Milwaukee 7, and Mandel Group for supporting that really important work. So with that, I'm going to stop my share screen here, and I'm going to hand it over to our panelists. So I guess starting with Angelique and then working, Angelique, Kathy, Darren, and Obi, if you could do a brief introduction of yourself and your background and what brings you here today to discuss transportation and community health.
Well, thanks, Dave. Thanks everybody for inviting me. I'm glad to be here with you guys. My name is Angelique. I am the Villard Avenue Business Improvement District Director. I'm currently working to revitalize the Villard Avenue retail corridor, which has probably seen at least 4 decades of both public and private disinvestment in a predominantly Black neighborhood. And just working really hard as far as economic vitality, public safety.
Where is that, David?
Infrastructure, improvements, especially this topic is definitely near and dear to me as I'm working public safety is pedestrian ways. It's a big initiative that's really important to me. So I'm working with DPW. I work with MCTS. I work with the Wisconsin Bike Fed, the Coalition of Safe Driving, even board director for Milwaukee Health Services Incorporated, to as far as public health. And this whole initiative is really important to me. So I'm happy to be here to share whatever I can. So yeah, thanks. Appreciate it.
Great. So good afternoon. I'm Kathy Gale, Executive Director of ERAS Senior Network. We're a community-based nonprofit organization serving older adults in Waukesha County and Milwaukee County. And we have run a volunteer driver program in Waukesha County since 1991. And we began operating in Milwaukee County in 2019 when there was a need for an organization to continue running what had been a very successful program called Interfaith Older Adult Programs, neighborhood outreach programs specifically. So we started doing that work about 2 years ago. So now we're working across 2 counties that have very large populations of older adults. And the people that we aim to serve are those who don't qualify for government entitlement programs. They don't have enough income to purchase transportation and other services. And they also don't have quite enough family or friends around. Often during the daytime, people are working. They can't take off work and take older adults to healthcare appointments and things like that. So we have a very large volunteer driver program. We also have a mobility manager on staff who helps people when they encounter all the difficulties that you face when you lose your ability to drive. And we have 2 vans that we use for transportation as well when we're not able to match with a volunteer driver. So this issue it's wonderful to see that the conversation is elevated to this level, because our region is really going to be facing quite a challenge for older adults who will be losing their ability to drive and living longer. It's not unusual to have people calling us for help at age 90 and 95 for the first time. They've just given up their ability to drive. So really happy to be here. Thanks.
Thank you, Kathy. Darren.
Thank you very much. My name is Darren Roush. I'm the City of Greenfield Health Officer, and I applaud you all, applaud you, Dave, for inviting somebody from local public health, because I think too often we're not at the table. In my role in the health department, I manage a lot of the programs and services that we do, but certainly a personal passion of mine is to connect public health to policy efforts that are going on both within Greenfield and throughout the region. So certainly have a personal passion for bike and pedestrian safety, and certainly we've done some good work here in Greenfield, recently securing a grant to create a trail in the We Energies corridor. So certainly here with a number of hats on, both as a local health department director, as an adjunct faculty at the Zilber School of Public Health at UWM, where we talk about these things. We talk about health and all policies and the importance of having public health involved in discussions on transportation, housing, and a number of other issues. So very happy to join today, and I'll turn it back to the next speaker.
Thank you, Darren. Obi.
Yeah, good afternoon, everybody. I'm Obi Unwa-Boozer. I'm the Community Impact Director for the American Heart Association for the state of Wisconsin. But then also interesting alike, I am the founder of Envision Growth, which is a Milwaukee-based real estate development group that's dedicated to building healthy people and communities through urban regeneration. And my work through the Heart Association, I've been able to focus on policy systems and environmental change. And with that, really understanding that our built environments and really looking to go beyond programming and into really the systems that create the structures in which we work, live, and play has been very important. And as most know, the mission of the Heart Association is to be a relentless force for a world of longer and healthier lives. So being able to really look at things from a policy level really looks to create that sustainable change. And we have worked with organizations such as the Bike Fed and others around complete streets policy. So transportation revolves in our world. Especially when we go into the dialogue and the depths of looking at social determinants of health and how that plays into how individuals are able to live longer and healthier lives within their built environment. So happy to be here. It's a passion of mine. This is the work I do and even the work that I do after work. So look forward to being a part of the dialogue.
Thank you, Obi. I'm, really happy to hear everyone's passion and interest in this. And I share that passion. I suffer from asthma. It's not terribly severe, but never had a doctor tell me that it's because I grew up next to I-94. But when you look at, the disparities in asthma and proximity to freeways, could be a factor. A lot of people have heard this story, but in 2006, I was 50 pounds overweight and had never really walked or biked much at all, and then got a bike for $175 and started riding it to work. And here I are, I'm 44 years old and feel better and more energetic than when I was 24. And it's really all because I made a different choice when it came to transportation. So, I'm right there with you with, the interest and the passion. So really appreciate that a lot. Any conversation around community health in 2021, I think really has to start with COVID. And Darren, I won't ask you the question that you probably get 100 times a day, which is, when will this be over? And at what point, can we kind of expect a resume to normal? But I am going to ask really the entire panel, as we look ahead, to the world beyond COVID, and here we're trying to take the long view in all these conversations. What have we learned? What have we learned over this last years and some months that we've been, in this pandemic? And when we look at what we learned, what should we be concerned about as we're looking to build a healthy society long term? So kind of main lessons from our COVID reality and what we take from that. So I'll offer that up to the panel, and whoever wants to take the first stab at it.
Well, I'm happy to start, just talk a little bit about the older adult population. The first thing that we did, like most nonprofits that are human service organizations, is figure out how to change our service delivery model right away in March. And one of the programs that we put in place was regular wellness phone calls. And we began calling people on a weekly basis to make sure that they had enough food, medication, and help with basic needs. And that program continues. I think in the last 12 months, we placed something like 24,000 phone calls. And what we've learned from that is that our older adult population doesn't reach out for help until the needs are close to critical. And through these telephone calls, we've been able to surface more health issues just because the older adults are coming to trust the friends who are calling them weekly. And just in casual conversation, they'll learn about safety hazards. They'll learn about healthcare appointments that are being skipped because they can't afford transportation or they don't know where to go for transportation. So that's been a big learning for us. It's a program we want to continue because we want to be on the front end, helping people to get their services before they get to that critical point. The other piece that we've learned is how important it is for people who are isolated and lonely during COVID to have had a community member or organization to connect with. And I think many of us, for maybe the first time, experienced that isolation and loneliness because we were forced to be at home without the normal connections we have. So many of us have learned what that really feels like, and hopefully we can keep some of these programs going to connect with people who are otherwise kind of invisible until there's a crisis and they reach out for help. And there's actually some pretty good evidence to show that there's public health impact when we address social isolation. So that's two of the big learnings that we've had.
Appreciate that. Thank you.
Yeah, I'll jump in next. Having worked in COVID for the last 14 months, it's really hard to envision when it's going to end and where we go. In fact, I was just talking to a staff member this morning and she asked, what did we used to do before COVID? Because, 100% of our role has been COVID over the last 14 months. But certainly as I look to, restart here in the Greenfield Health Department and to this question, how do we restart in the community? COVID has shown a light or shined a microscope onto some pretty significant issues in and around Milwaukee County and through the region. So I certainly think it would behoove us to look at those issues, look at issues of social determinants of health, racism, transportation policies, social isolationism, the lack of connectedness between, different partners, throughout the region, and really work and try to capitalize on, this pandemic that has really changed our lives in so many ways. But as we try to think about a reset, I think that's going to be really important. How does public health connect to all of these different areas? How do, other people who are listening to this connect to public health? And it would be a disappointment if we got to the end of the pandemic and started our new phase and we didn't purposely think about these connections and this interconnectedness of the public health system to address policy changes overall.
Absolutely, absolutely, Darren. I just want to jump in with you. My comments might be a little bit all over the place, but definitely relevant. I feel like I learned that we have allowed the media to control the narrative with what's going on in our communities, and that we, the people, we need to control the narrative, and we need to let the media know what's actually going on, because there's a lot of miscommunication going on. And I think we all can agree there was this whole Asian thing, then it turned to Black folks can't play basketball at the park because we really didn't know what was going on in the city. There was a lot of miscommunication that caused a lot of frustration and whatnot. But then we also saw people who were maskless that were, marching, tearing down cities and the Capitol about things. And it was just a lot of miscommunication as far as that. So the narrative has to be controlled. I feel like we definitely need to build more trust with the communities that we serve, because we know that there's been a lot of, historically, there's been a lot of, medical experiments and things done on Black communities, Black and brown communities. And there's just a mistrust. That's why we still have, we even have medical professionals that are Black and brown, that are first line providers that aren't being vaccinated or whatever the case may be. There's a lot of miscommunication. And as a friend of a virologist, I have to say there's still also a lot of, media things that are happening where there's medical doctors that might be pediatricians. They are professionals, and I do respect them, but they're not virologists. That they don't create the vaccines or be able to give out that information. So I like to see more virologists, people that work the closest with these viruses that create the vaccines, actually the face for talking about it, not necessarily medical doctors that are actually administering the vaccine. So that's very important to me. Also, just being innovative enough to create easily accessible transportation ways to make sure that people are able to get to their doctor appointments, to get to fresh grocery stores, to eat well and be well, and show them where local outdoor activities for them to be active, like you said, Dave, to, just, physically active, to get to their pharmacies, vaccination clinics, whatever the case may be. And then also, like Darren said, be collaborative enough with other organizations that are doing this work to just equip people with the tools to help them know where to go, what to do. There's people who have insurances that help, that where they can set up medical transportation that can get them to where they need to go. Can we help them a little bit more? So that's kind of like my train of thought. So I'll stop there and let Obi chime in if she'd like to.
Yeah, I'll make it short because I know we have a ton of various pinpoints for our dialogue today. One of the things I wanted to point out is that, Milwaukee is really the economic engine for the state when we look at the GDP. And of course, you have places that are leading behind in areas such as Madison and Dane County and Green Bay, Appleton, Oshkosh, and Racine. But when we then look at the state of the health of these counties, you know, the 2021 health rankings lists Milwaukee as 70 out of 72. And I believe the 2020 health rankings listed us as 71 out of 72. So yeah, we're now 70 out of 72. But when you think of a city or a county being the economic engine for the state, but falling at the bottom hopelessly when it comes to health, that speaks volumes. And COVID-19, we have seen exacerbated health effects when it comes to just based off of where you live, when it comes to your demographic, when it comes to race. And if we don't address those things, we're going to continue to see some huge differentiators in health, but then it's going to slowly start to affect our GDP. You know, when people aren't healthy, the businesses can't be healthy, the ecosystem can be healthy, the built environment can be healthy. And we don't want to start seeing that trickling down into us being the economic engine, because that's going to create a larger issue that I don't know if we'll be able to handle.
Thank you, Obi. You know, what I hear, the common thread through these comments is really trust. Trust and connections and connectivity between people. And, you know, when the new year happened and it was 2021, I said, you know, my word of the year is going to be trust. Because I think 2020 was a real sucker punch to a lot of us around that question of trust. And, you know, the fact that we're all in kind of separate rooms and not together and we're over Zoom, that certainly doesn't help with that. But I guess the question will be, you know, we've learned lessons from 2020. Do we carry those lessons forward into 2021, and how do we do that? And then that's where I think the connectivity and the connection piece come in. And, you know, that trust piece works in transit and transportation as well. You know, because our transit systems here in Milwaukee County Transit, I believe have done a tremendous job in building that trust. You know, the reduced capacity on the bus, the free masks for riders to use. You know, the whole rider experience has been pretty positive, and you know, in kind of a very uncertain and you know, scary time and scary world. That's huge. That's really important to, you know, that people have that kind of reassurance. So I really appreciate everyone's response to that question. Now, bringing it very specifically to transportation. You know, in most places in our region, a car is really your main option or your only option. And throughout the pandemic, especially in the early days, the message was very much like, stay in your car. You know, don't get on a bus, and stay in your car because that's the safest place to be. You know, over at American Family Field, they had the drive-up clinics, you know, where you could get tested in your car. Everything was very much, you know, the message was stay in your car because that's where it's safest. But you know, in Milwaukee County, we did see Milwaukee County Transit saw about a 50% reduction in ridership during the pandemic. And that is a lot, that's significant. But, you know, the Metra in Chicago, which is a commuter-based system, saw a 91% reduction in ridership. Why is Milwaukee's less? Because we have a lot of folks here that rely on the bus, you know, the essential workers. But for, you know, a lot of places around the region, your car is really your only option. And, you know, I said earlier that half of the jobs are located outside of that transit scope. So what does all of that mean for health outcomes across the region? I mean, the fact that we have a very car-oriented region with some pockets here and there where it's easy to walk and bike. We have a very high percentage, comparatively high percentage of folks without cars, mostly not by choice, but because, you know, for economic reasons. So what does all that mean for our health outcomes and the disparities that we've talked about?
I mean, I think it's a problem. Like you said, people need to be able to get to their doctor appointments. They need to get where they need to be. Like, I'm a huge advocate for pedestrians being able to get around in every way possible. I support rails with trails to be able to like start looking at our railroads and like right now we have like extreme dumping. And like, I feel like we could actually create that trail to connect our city to get people who aren't drivers around. We know that drivers are going to be able to get around, but I support the high speed train that connects people. The people might have to go to a specialist that's out further, or whether the case may be. I support cyclists, people who take public transportation. So I'm for the bike infrastructure, high visibility crosswalks for pedestrians, people that are walking their wheelchairs or mobile scooters. I support the mobile clinics as well. I mean, Dave, I'm definitely, I'm more of us creating for health outcomes. We need to create the infrastructure to be able to help people get their health care. So I'm an advocate for the infrastructure side of this.
Yeah, I think it's safe to say that many areas in the greater Milwaukee area were kind of built on a reliance for cars. So even in my community here in Greenfield, we do not have sidewalk access, as much robust sidewalk access as we would like. We have way too many areas of the city where people, if they're going to go for a walk through the neighborhood, are literally walking on the shoulder of the road. And in many cases, it's not even wide enough for an actual, walking path. So, any community that's not walkable or bikeable, we certainly have to be concerned with motor vehicle safety, with pedestrian safety. And certainly any time that we have to get into our cars to go someplace, it makes us less likely to be physically active. If I can't walk to the grocery store, the post office, those sorts of things, I'm going to be doing those errands in my car because that's where I need to be. And, Dave, you told your personal story, and that's so real for so many of us. I had the luxury of growing up in a very small town in rural Iowa. So you walked everywhere. You walked to the supper club, you walked to the bar, you walked to the post office, you walked to the hardware store and the grocery store. That certainly is nothing like the community I live in here in Milwaukee County, but it would be such an ideal if we could get to that. And it's going to take some changes, but certainly there's a lot of health and economic benefits that could come from that redesign.
One of the changes over the years that definitely has impacted older adults is that a lot of healthcare went from local to regional. And in doing that, what could have been walking or a short ride that you could have had from a friend or a neighbor or a family member, now you have to cross over different municipalities. And we're very fortunate in our region that we have excellent healthcare and hospitals, specialists, but access to those services is inequitable now. So you could have the issue with safety. On the other side of that, you have the issue with isolation, like in the rural parts of the counties around Milwaukee County in particular. If you have to go from the southwest corner of Waukesha County into Milwaukee to see a particular specialist, that ride is going to cost you probably $150 to $200 each direction. And it's not because the transportation provider is making a lot of money. It's because it's such a long time period. And so that person can only take one rider. They're off the books otherwise. And there aren't too many people who can afford to pay for that kind of transportation. And even when older adults move into senior communities, sometimes the families are surprised to find out that there may be help coordinating the transportation, but you still have to pay for it. So if you don't have that income, you can't access that great health care. And it really does become a problem that, again, is kind of invisible. If you don't go to your healthcare provider, nobody's really paying attention to that until you show up in the emergency department with a lot of acute emergency issues that probably could have been taken care of if the person was able to get to their regular appointments.
And, I think Kathy brings up a great point. When you think of the disparities within transportation, even just some of the data around health, like the trends that are going on right now, like 47 adults will be obese by 2030. And then, nearly 80% of the US adults and 75% of adolescents, they don't get the recommended weekly amount of aerobic or strengthening activity. So, when we look at today's built environment, we have to figure out how physical activity opportunities can be embedded in how we transport ourselves. And then when, Kathy was mentioning being able to not get to our appointments, that's a huge barrier. There's been a push on this sedentary lifestyle during COVID, and we're going to see greater risk for diabetes, heart disease, premature deaths if we don't figure out ways to create a greater ecosystem for those to be more physically active as we look, to do different things. When we look at a lot of the walkability scores in communities, they are card dependent walkability scores. It's not that the walkability scores aren't strong, but once again, like Darren mentioned, we are very card dependent in a lot of our communities, even if there's a park down the street, or even if you do have the ability to walk to get to somewhere. Even if somebody is adequately able to physically get to somewhere, we are very card dependent. So how do we look to create ecosystems and small p policies that creates a built environment that'll be sustainable for individuals to be healthier?
Appreciate that a lot, Obi, and that's a perfect segue to, my next question is really around those policies. What we're talking about here is change, and a lot of times, we'll say, well, things can't change. I mean, it's just is what it is. And, I like to think back to things like smoking, right? I'm 44 years old. So, even up until probably the time I was in college, it was common to see people just light up a cigarette and just start smoking pretty much everywhere. Now, if I was to light up a cigarette right here, right now, socially, most people on the call would be like, Dave, what are you doing? And I probably would get kicked out of here, where I'm sitting in this office space. So, things can and do change. And I think sometimes, that change is so gradual that we don't really notice until you really kind of think back, or maybe watch a TV show like Mad Men, which I'm now, rewatching in the pandemic, where everybody's just constantly smoking like a chimney. So that was, policy, that was personal choice, that was a whole bunch of stuff that came together to make that happen. So, specifically from that transportation standpoint, what do we need to do, to Obi's point about that, the policy levers we can pull to get to where we want to be, which is less of a need to have to drive everywhere, more encouraging so that you can walk and bike. And then, we enjoy those different health outcomes across our region.
So I'll start. One of the ways we try to challenge policymakers to think about this is to consider how they would get from point A to point B without their car keys. And we've done this in rooms full of people and gathered up their car keys and then given them maps, and they can use their smartphone. And we say, okay, you're at home and you have to get to your job. You have to stop for a lab test on the way home and the grocery store. How would you do that? And somehow bringing it to the personal helps it to not just be this very large issue of transportation and transit and what does that even mean, but you've got to kind of bring it back to a person to consider. They may not be able to do any of those tasks. You may live in an area that's not safe, and if you're using a walker or you have a disability, you can't wait for the bus at a corner. It's just not safe for you to do that, so you may not go, and then you might lose your job. So we try to encourage people to look at it as something that isn't, it's like COVID-19. When we get to 500,000 deaths, you can't even function with that. But if you can think of 2 or 3 families who are impacted by a death from COVID, you understand it better. And the same thing with transportation. If you can get people to connect to it, then you can start asking the questions about, why is this not prioritized? Why is it not important to talk about it?
Thank you. Appreciate that.
Yeah, I think to Kathy's point, we need to continue to work on relationship and capacity building with our elected officials. So the exercise she talked about was great. Like, how do you get from point A to point B? In public health, we talk a lot about a health in all policies strategy, where any policy that's being considered, we're thinking about the health impacts. What's the health impacts of that subdivision? What's the health impacts of of this trail? What's the health impact of placing this particular business here? And I think that's a lot of where we need to go. Thinking about shifting that focus from cars to other modes of transportation. It does help that some of our federal funding for road projects, even in local areas, includes things like bike lanes now, includes the building of sidewalks, because that's certainly been needed in my community. But I think we also need to think broader and thinking outside the box by engaging people from other sectors to really think about the system and how the system is impacted by some of these decisions.
Absolutely, Darren. To your point, I have to go back to infrastructure. I'm a big advocate for that. I believe in the process of elimination in a sense. So we're paying taxes. We pay them over to our city departments to do certain things, and infrastructure is a big deal. I mean, I'm struggling over on Biller Avenue. It's a over 70% walkability, Obi, in the district. But we lost St. Michael's Hospital, for example, a few years back, probably a decade ago now, I'm gonna say a few years, but and that was an emergency department. We have extension that replaced it, but it's a small family clinic and it doesn't have an urgent care. So people in that community lost that. My sister walked over there to have my nephew, that's 17 now. That's gone now. And so, I mean, just using that as an example, the community doesn't have that. So for one, we definitely need to, I mean, I don't know how to even put this into words, but like, I question sometimes the integrity of some of the providers. Like, is everything like this, we put profits over people? Of course I'd like to see Medicaid expanded where doctors are, have some integrity and, about being in certain communities, serving are we here to take care of people's health? Or are we here for profits? There's no reason why there's no urgent care or no doctor office in that area. What is the problem? And so those are really questions that I ask myself. But in that same breath, yes, I'm fighting for infrastructure. Like, yeah, we probably have people that don't leave out the house and go nowhere. We have no bike lanes. Still in 2021, no bike lanes on Villa Avenue. We have no height, you barely can see the two painted lines for a crosswalk. So yes, I'm fighting for high visibility crosswalks, things that make people feel safe so they can start moving around. I don't think it's safe for somebody on a mobile scooter or somebody that has any physical issues. I've had 2 surgeries on my right knee. My first injury was when I was 17. I had another surgery 2 years ago, but there's days where I'm pretty sure if we don't have the right infrastructure there, I might not be able to move across the street quick enough, could lose my life in the process. So what decision do I make? Do I stay home and let me deal with the pain and get through it to make it to another day? These are the thoughts that go through people's mind in our community. So I'm fighting for that infrastructure, those infrastructure improvements. And I would love to, again, see the collaboration between entities in the community, be it health, bids, businesses, residents, everybody really coming together to fight the good fight, to really just help support that. So I'm gonna leave it there.
Obi, anything to add around policies?
Yeah, I mean, I was gonna really add on to what everybody said, especially what Angelique was saying. When we look at community planning and research around health behavior, it's really demonstrated that like our built environments influences people's decisions to use public transportation, whether they want to drive, whether they want to walk, whether they want to use a bicycle, whether they want to use a motorized scooter, whatever the case may be, whatever mode of transportation people choose. And when we really look at designing our community environment, we have to consider open spaces, parks, trails, mixed land use, trees, greenery, accessibility. And when we think of the design of that infrastructure, the community has to be at the table. It can't just be elected officials. It can't just be government officials. It can't just be me, Angelique, Kathy, or Darren. It has to be the people who live in those communities, who live in those zip codes, because they know what they're lacking. They know what their barriers are. Yeah, research says whatever, but personal experience speaks a lot larger when you're hearing it from the mouths of those who live the day-to-day lives of those experiences. And being able to have the community at the table when decisions are being made will help us when we decide to make policy, when we decide to say this is what needs to be passed, because essentially now the community has to hold us accountable to what they said was their issue, right? If they're not at the table, what we're advocating for, what we're putting at the table is based off of what experts, of course, feel should be advocated for, but the community's voice is lost. So making sure the community's voice is at the table, make sure that they can hold us accountable. And if things aren't going in the direction of what they said that they're missing or their barriers are, then we can say there's really a problem here, that individuals are not doing what the community needs. Individuals are not delivering on what the community has asked for.
Yep. Thank you for that, Obi. I think it's so much too in how we kind of frame and really sort of meet people where they're at. And, and I think about, as a 16-year resident of Sherman Park, I lived there from 2004 to 2020, left just before the pandemic. I was pulled in because everybody knew I was a big bicyclist. And I was active with the SPCA and Sherman Park Community Association. So I was pulled into a number of conversations around bike lanes. And, the reaction in many of our communities in the neighborhood was, they're kind of useless, or really, at best they're useless. At worst, they're basically a path for gentrification. And what I would always try to encourage advocates to do is meet people where they're at, because what people are concerned about is the reckless driving. That's why a bike lane like the one on Roosevelt that went right by my house was rarely used, and I never used it. Why? Because people drive crazy down that street. So that doesn't mean don't do the bike lane, but maybe design it and frame it in a way of look, this is solving the problem that you have, which is the reckless driving. That's the root cause. Otherwise, it's just a coat of paint. So that's my own little editorial there. So individual choice, and so often we put this on individual choice, but it all operates within the policy sphere. When I started riding my bike to work in 2006, I thought, well, other people in my office building will see me doing this and see that I'm okay and losing weight and making friends and living my best life, and other people will do it. And that didn't really happen. I had a friend here or there that would do it, but for the most part, very, very few other people did it. And the reason they didn't do it because they didn't feel safe doing it. And I completely respect that. I'm not gonna, lecture people on what they feel safe or comfortable doing. So, within that kind of policy sphere, those are all kind of things that are really important and important to tackle. But what can we do right here, right now in 2021 to make our own selves better? And, I'm a huge believer that things change one square at a time. I've got my square. I'm going to work on my square and make it awesome. And then the square next to me, I'm going to encourage them to fix their square. And then if they work on their square, and then before you know it, all of our squares improve. So what can we do on our own square, in our own sphere, right here, right now, to make things better in the short term?
I would at least want to say, Dave, I gotta say, some of the streets, infrastructure. We need protected bike lanes on some of these streets. Some of these streets, we can't just put the pedestrian next to the traffic.
Right.
We're actually infrastructure wise, when it comes to safety, Milwaukee it ranks really low. If you want to really make cyclists and pedestrians safe, you have to make protected bike lanes on areas like that. So I definitely have to touch on that. But aside from that, man, I'm let's promote and provide fresh food access and food deserts. Let's expand farmers markets. Let's expand mobile clinics and markets, like I think it's I'm sorry, help me out. It's one of the food banks here has the mobile clinic. Not the mobile clinic, but the mobile food market. I think it
I
used
think
to be
that's, is that Hunger Task Force and
Thank you,
partnership
Hunger
with,
Task Force,
yeah.
because thank you, because it used to be, I think Pick and Save or something before, but like now it's the Hunger Task Force, but it's only one. And I reached out to them recently and I looked at their calendar and it's usually booked up for 3-4 months ahead, but most of their hours are like between 10 and 2, and like, so we need to partner with that. And again, collaboration, so they're doing their part. How can we get some other partners in to be able to expand on that and do some of the other hours, that they don't do to help support the community. More community outreach from providers that look like and come from the communities that we're trying to serve. Sitting on the board of directors for Milwaukee Health Services Incorporated, I mean, serving over 30,000 Black and Brown people in the community, being able to Dr. Izzard is the CEO there, and he actually has a national model for the recruitment and retention of providers of color. So you have to have people that look like and are from, the community to serve them. So those are some of the things that I think would be great that we can do. We can start implementing right now.
One of the great things that we saw as of the onset of the pandemic is people stepping up to help with delivery of food, and particularly delivering stock boxes and fresh food from wherever we could help an older adult order it. And we're retaining quite a few of those volunteers. So having people step up and in all communities, whether it's Waukesha County, Milwaukee County, and around the region, having volunteers who are willing to put in an hour or so a week to make that delivery means that that fresh food is getting to people too. Because it's the worst thing in the world if somebody's eligible for a stock box or other types of food, but they can't get it because they have nobody to go pick it up for them. And you really can't get on a bus with a stock box. If you're an older adult, they're about 35 pounds, and it's just, people have tried and it's really challenging. So stepping up to help volunteer. I'll give a shameless plug for Drive, Give, Serve is a big volunteer driver initiative that we have going on, drivegiveserve.org, and it's throughout all of the counties in the area, just to help older adults, get them their food, prescriptions, and rides to healthcare appointments when they need it.
Thank you.
Yeah, some really great solutions have been offered, but I just want to kind of focus my comments to the individuals. So individuals in the community, have a role. And one of those roles, as Kathy just mentioned, is to get involved, volunteer with organizations that are doing important work in the community. All local communities with health departments, have feedback opportunities to talk to the Common Council, to talk to elected officials. In our community, we have a very active community health assessment process, and that has created a coalition that we tackle health issues. And by becoming engaged and learning what's happening in your community, you can make a difference. Even little things like sharing social media posts, sharing knowledge of resources and other events that are in the community are very, very important. But I think engaging and participating in the process is a big way to make change.
And to add to Darren's point around that, the American Heart Association has a platform called You're the Cure, YOURE, thecure.org. And that platform allows community members to get involved with policy. So when we have policy that goes up where we need community input or a coalition and stakeholders from the community to get involved, whether that's Fresh Food Access Fund or Complete Streets policy, we're able to say, hey, if you sign up to You're the Cure, you'll get an alert to be able to get involved with that policy and being able to follow with the news of what's going on with that particular policy as it pertains to your community and demographic and or zip code. So I think it's very important on a grassroots level and people in their communities to get involved while we're also at tables utilizing the experts and the research to back up various directives around policy.
Thank you. Thank you, Obi. Thank you, everyone. I'm going to look at I do have a question here from the audience, and please type any questions that you might have in the Q&A. This one comes from Jackie Zeladon at MCTS. So bus routes with more high frequency and more local routes are being added to MCTS services. That's the MCTS Next. How do we envision these improving health outcomes? So the bus system redesign, so we have more high frequency routes around the city, around the county.
Hey, Jacqueline. I work with them to beautify our bus stops on Villard. You know, we care about our pedestrians, and if you know you are traveling and you're needing a place to sit and wait for a minute, we just want you to be able to see photos of people local from your community, and to have some art there, just beauty at the bus stop, like Jacqueline calls it. But I my only comment to that is that I think I was a part of the planning. I went to those meetings for MCTS and gave input. And I like that they did their job as far as having, you know, the community visioning and inviting the stakeholders to be a part of the planning. And I think that they did some great revisions. So my only comment is about the bus shelters. I'd like to see some more design and planning around the shelters because of people's, you know, the different ages, different abilities, working with the bids, working with the community, seeing if we can create another model where that's not solely on MCTS either, to provide nice quality shelters where people can have some shade to be able to sit down and rest. We don't know what people's going through. It could be asthma, like you said, Dave. It could be my knee. It could be just someone who has a couple of kids that need to sit down for a minute. There's a lot of even high frequency bus stops that don't have a place to rest. And I know I've heard a lot of comments from the community about, oh, well, homeless people are going to sleep on them and all of that. Like, we're not going to judge. You don't know what those people have gone through. But my biggest comment is really just, if we're going to stop, we have shelters because people need to sit down and need to rest for a minute. And I'd like to see some more planning and visioning around that, not just the actual stops themselves. I mean, the lines themselves. I think they've been doing a really good job as far as cutting some that are low frequency to increase the high frequency, but also really taking a look at that from that angle.
And I just wanted to add to that, Angelique, that could be considered a transportation enhancement as well. And that's where on the funding side, that's part of policy and being able to advocate for more funding for things of that nature on those bus stops, because that is also essentially plays into safety. When we think of people being protected by the high traffic and the congestion of traffic, by adding more transportation to the streets, we have to make sure that while people are waiting to get on a to get transportation, that they also feel safe. And I believe that that's something that, as we look at policy, we can advocate for further funding for how we're able to create transportation enhancements through being able to make sure that pedestrians are safe.
Thank you for that. I'm really happy to hear you guys advocating for better bus stops. I think we often overlook that, but you know, that's a huge piece of the puzzle. You know, there was a study done in Salt Lake City where, you know, they just improved the transit stops, the bus stops, and, you know, things that a lot of folks don't necessarily think of. But, you know, it had a huge impact on the ridership and the whole experience of using the system. And I think psychologically, if you're just kind of going down the street and you see a bus stop that looks like it's supposed to be there, it has a nice bench, it's attractive. I mean, that makes a much different impression than, you know, just kind of some concrete and no place to sit and, you know, just a sign. So I want to be respectful of everyone's time. We are at 12:56. Kathy, Darren, anything to add around the kind of high frequency bus, you know, design, just basically, you know, quicker and easier to get around, or anything around that?
Only thing I would echo is what Obi said about it being not only the transit provider's responsibility, because it really does reflect what the community feels, and having that safety, attractiveness, and having it be part of the community, there's a pride in that too. So I really, really appreciate that comment.
Yeah, absolutely.
Yeah, and I think the only thing I would add is that, the changes to the routes, changes to the frequency, changes to the placement of some of the bus stops really speaks to the fact that, MCTS and the leadership are listening and they're willing to make some changes. And I don't know all there is to know about what they do and how they do it, but specifically to make changes really speaks to the fact that they're willing to listen and they're willing to, be innovative. So I think giving it a try makes all the sense in the world.
Yep. Thank you. Yeah, absolutely. And, I think when you're within that kind of densely populated, built up part of the Milwaukee County, the city, first ring suburbs, you see a great enhancement of the speed of the service, as I've personally witnessed that with Next, some of the transfers are a lot quicker, which is great. But we have a big metro region, and that very same bus route, which can be very useful for 2 or 3 miles, could take quite a long time to, if you extend that all the way, across Waukesha County or some places a bit further from the city center. So we won't solve that here on this panel, but I want to thank everyone, thank all the attendees for joining us. And I especially want to thank our panel, Angelique, Kathy, Darren, and Obi for joining us today. Really appreciated you guys taking time and sharing your insights with us. And I'm going to close here with another shameless plug, and that is for our next session coming up on May 12th, and that's transportation and workforce. So I'm really excited to have Shayla Fay, Sakuri Fears, and Fred Anderson joining us next week to talk about that intersection of transportation and workforce, and that'll wrap up our 3-part series, 3-part spring series. So again, thank you everyone for joining us. Thank you panelists, and enjoy the rest of your day.
Thanks, Dave.
Thank you.
Mike.
Thanks, Dave. Thanks for the
Thanks.
invitation.
Thank you.